You know, if there's one thing that you don't want to neglect in your life, it's your teeth. You'll be starting at a young age, taking care of them for so many different reasons, you know, usual yearly checkups. But it gets to a point where there's a little bit more that you might have to be taken care of. Well, what you do is you make an appointment here to Mississippi Dental Arts on 2nd Street in Pass Christian. Dr. Trace Favre can cover a wide spectrum of things, plus the fact that they've got this new technology, can find things that you would not believe are important. So let's go in and talk to Dr. Favre, find out more about Mississippi Dental Arts. Dr. Favre, nice to meet you.
Yeah, thank you so much.
Tell us a little bit of background about yourself. I mean, you are a native of the area.
Yes, sir. So I grew up here on the coast in Long Beach. I've really been gone for about 10 years between school. I did a residency up in Birmingham, Alabama, and then my wife did a residency in San Antonio. So we've been out of the coast for a while, but you know, we always called it home and always wanted to come back here. We knew this was our long-term home, and so it's just been great to be back home. We moved back in June, opened up August 1st. So it's just been awesome.
I mean, you've got a beautiful facility here, and we're going to show you around a little bit here in just a little bit. I mean, being new, a new patient comes in. Walk us through the procedure. I mean, you're a little bit different than most dentists, the way you work with patients.
Absolutely, that's correct, Tim. So our new patient experience, I think, really sets us apart. It's something that we do different than any other office on the coast that I know of. And so it's essentially the new patient experience is typically done over 2 visits. The first visit I call like the data collection visit. So we get you in, we take all the x-rays of the teeth, including a 3D scan. We take photographs of every patient. We do an exam. Sometimes the teeth get cleaned that day, just depending on the patient's needs. And like I said, I just get all the data that I need. And then I'd sit down and study that case. You know, we dismiss a patient, I sit down and study that case later. And then I bring the patient back. We don't charge for a consultation as part of the new patient fee. Yeah, so we sit in this room right here around this table, and it's important to me to be sitting next to the patient. And we kind of put your case on the screen and we talk about it. And we talk about options. You know, we talk about how your mouth and your oral health is going to affect your overall health.
Oh, definitely.
You know, and so I'm really big on oral systemic connection. That's important to me. And so, you know, we kind of sit here and like I said, I really believe in...
Look over the perfect treatment plan,
right,
which could be 1 visit, could be a few visits.
Absolutely. And it's important that I treat you in accordance with your values.
Right.
So the same case as far as what I see in your mouth, we may have a totally different treatment plan for 2 different patients, you know, that present the same way, depending on what their needs are and what their wants are.
And what you're finding in there as well, because that's one of the important things, as you mentioned, you know, a lot of people don't realize the importance of good healthy teeth are to the rest of your body.
Absolutely.
Especially if there's an infection that, well, you've got a machine that will find that infection.
Absolutely.
Which is amazing.
Yeah, absolutely. So that's right. We have a 3D cone beam. We take that on every patient. It kind of replaces a 2D pano that you'll find in a lot of dental offices.
The Panorex.
Exactly, yeah. And, but I will tell you, on a daily basis, I find infections that we would have missed with a 2D scan. We're just so much more accurate with a 3D scan. Yeah.
Well, we're going to take you back there and show you this wonderful 3D scan machine that they have here in Pass Christian. Now, this is the 3D unit you were talking about. What makes it different than a regular Panorex?
Yeah, so we get a totally different image. It's totally different. We can kind of get a 3D image of the skull and look at different slices. I can kind of look at that in any way that I need to. So, like I said, we find a lot of fractured teeth. It lets us do implant planning. We can even evaluate patients' airways. So a lot of cool features that this guy
evaluate their airways?
Yes, yeah. So,
really?
Yeah, we'll measure airway volume, and kind of it's a screening tool for sleep apnea. It doesn't diagnose sleep apnea, but it's something I do talk about with a lot of patients.
But it gives them an idea that there's a possibility of sleep apnea to happen if you don't have open airways.
Correct.
That's really cool.
Yeah. So.
And implants, y'all do implants?
We do. Yeah. So pretty much any implant that needs to happen, we can do here in house. You know, from single teeth to full arch implants, fixed set of teeth. Kind of, you may see advertisements where somebody comes in with teeth, They leave in a day, and we can do that here. So,
oh, nice.
So it's pretty great. Yeah.
And you mentioned infections. How important is it to detect an infection?
It's huge, right? So systemic infection or oral infections cause a lot of systemic issues. And some of those they're chronic problems. So you may not feel anything or it may not hurt, but you know, it can lead to heart attacks, strokes, even to Alzheimer's.
Oh my gosh.
So it's important. There's 56 diseases related to oral infections overall.
Holy crap.
Yeah, so it's a big issue.
This will find them.
Absolutely.
Oh, that's amazing.
So,
well, we got one other piece of technology we want to show you here today. You know, Doc, one of the things I hate is when you have to do impressions and you put that stuff in your mouth with the trays and the clay and all that, and you have to bite down on it. That's nasty.
Right. Yeah, it's not too much fun, and it's not fun for us either. And you know, there's a lot of material waste and things like that. So we've kind of been able to avoid most of those impressions with our intraoral scanner. It's actually more accurate, a lot more comfortable for the patient than those traditional goop impressions, and no gagging, anything like that. So
wow.
It's been a really nice addition to the practice. I really couldn't imagine practicing without one at this point.
So that gives you a good look at the what exactly that they need when it comes to, you know, I guess what, implants, fillings?
Yeah, typically we're using this for diagnostics, and then for, you know, impressions if we're doing a crown, if we're making a night guard, things like that. Instead of taking the traditional impression, we're using this machine to capture the data that we need. As far as diagnostics, it's really cool because we're able to quantify wear and recession of the teeth. You know, so we take the scan, and then maybe a year or two later, we take another.
We got about a minute left. Talk about some of the cosmetic stuff that you do. I mean, as far as whitening and things like that.
Yeah, sure. So pretty much, you know, we offer a full spectrum of cosmetic dentistry. Tooth whitening here in the office. I have core whitening. It's KOR, really high quality whitening. For people that have tetracycline stained teeth, it's awesome. They've been told they can't whiten before, and now we can.
Wow.
It's pretty cool. And then we do, you know, veneers, crowns, kind of whatever the patient needs.
I mean, you do the basic dental stuff as well. I mean,
Right.
fillings and things like that, or
Right.
cleanings.
Absolutely. So
You know.
a full spectrum of general dentistry,
Okay.
from treating gum disease to the really high-end cosmetic stuff.
Well, I mean, I love the way that you know, y'all have the girls that are, you know, working with that. Tell us real quick the hours that you're open.
So we're open here in Pass Christian Monday through Thursday, 8 to 3.
8 to 3. Okay.
Yes, sir.
What you need to do is make an appointment today. Give them a call. Numbers on your screen. They're located on 2nd Street in Pass Christian. It's Mississippi Dental Arts.